Hi, I'm Dr. Richard Arabitg. I'm a plastic surgeon, double boarded in Orlando, Florida, and I've been practicing for over 25 years. And today I want to kind of talk about the new trends that I've seen happening through Florida in the Southeast. One of the things I've been seeing a lot of people coming in for is for butt enhancement, augmentation, and lifts. And I'm seeing more and more mistakes being made by South Floridians that they think that just bigger is better without the lift part of it. A lot of people are getting fat transfer, and they're calling it a BBL. But unfortunately, if you don't have the butt skin laxity or the butt in the right place, all you're gonna do is make a heavy, saggy butt with a lot of dimpling. Not only is that a problem, but the donor site has become an issue, and most people that are doing the procedures are not adequately trained or really just don't care. They just want your money, and they're leaving you dented and disformed, disfigured in the front end of your abdomen, which is a lifelong problem. I find that education to the patient is the best thing to prevent this. The first thing I should tell you when you're trying to enhance your butt is pinch your butt. If you're able to pinch more than 4 or 5 inches, you probably need some sort of skin tightening procedure. Because if you don't, if you just fill it in, it'll just sag and look worse. The worst thing I'm seeing is illegal silicone injected and other items injected into the buttocks. This is absolutely contraindicated. It's being done in several places illegally, and even at some spas in Miami and in Orlando in Central Florida. This is absolutely hazardous and can kill you. It initially will look good, but can, over several weeks or months, get infected or cause severe inflammation. Let me warn you on this, because I'm seeing this now almost sporadically, endemically happening. They're coming into my office 7 years after silicone injected in Colombia or in Miami. Their butts look like flat, inflamed tissue. It is unfixable. I cannot even cut this out with all my training. So it's a lifelong problem and dilemma. What I'm doing a little different than most other doctors is I'm evaluating the patient, looking at the quality of the skin, and if exactly they're a good candidate for fat transfer, or they may need an implant, which I do quite often, or they may need a lift of their butt. I also do a very special surgery that's unique to my practice. Nowhere else is it done where you do a fasciocutaneous flap, where I actually take the skin that's already yours and actually use it as an autologous butt augmentation, which is a very slick procedure. I've been doing this now for about 20 years. I've done probably over 150 of them, and with very, very good results. With a nice tonicity to the butt, a perky butt, and a full butt. And no long-term problems because it is your own tissue. You do have to be a good candidate. That's something that I or my staff have to assess here in person. So I would encourage you to at least seek a consult with me and just get a good, honest opinion. With that, you can go and search the seas and you'll be much more educated patient. The other thing I'm noticing a lot more of that I don't encourage is these commando operations. I'm seeing Dr. Miami or whatever, Las Vegas, whatever they're calling themselves, spas. They're doing 7, 8 procedures on a patient at one time. This is absolutely contraindicated. I want to make sure you all understand this. It's dangerous. The American Board of Surgery and the plastic surgeons who have well-trained in general surgery all understand that long operations, long surgeries with multiple procedures are not safe. It is much safer to do one surgery and come back another day than to put a lady or a man through a 7 or 8 hour surgery. We've all known this for years. It is getting so bad in South Florida, it's endemic. They're killing 1 patient a day down there. It's horrible. It's sending a bad message for plastic surgery patients that plastic surgery is detrimental and scary. It can be done very safely in a well-suited facility, accredited operating room, and a well double-boarded surgeon. I'm very honest with my patients, and I think they pick up on that. I'm not going to take anybody's time, money, or take a risk in anything that isn't going to lead to 100% improvement with good satisfaction.